Hey, welcome to
Doceree Dialogue,
a platform that unites industry leaders.
Come together and exchange ideas, innovation, and insights.
shaping the future of healthcare marketing.
Well, why don't we do this to kick things off and help the flow of our conversation? Why don't you start off with your name, title, company, and tell us a little bit about yourself?
Sure. I'm Mike Julian, or I go by MJ. I am the Director of Audience Activation Partnerships at Definitive Healthcare. I joined Definitive Healthcare via acquisition of Populi, which does consumer targeting, HCP targeting with probabilistic modeling. Spent my career doing that. Then my interest level in coming to Fierce Pharma is we're being really intentional about audiences and digital.
We've been speaking with a lot of our partners here at the show, most of which have been data partners, which is great. And one of the things I want to make sure that we highlight is your key differentiators as a business, right? And how you set yourself apart from maybe even other solutions that are maybe offered today.
Yeah. So again, Definitive, the core strength of Definitive's offering was the proprietary reference and affiliation of how hospital systems and providers are related to each other.
Okay.
That's something that they grew over time. It was the backbone of the company. And then claims data that came on the back of that. Then through the acquisition of Monocle, which is our key opinion leader data set.
Got it.
And then Populi really brought in an up-leveling of these capabilities to extend to digital. So rather than just selling data feeds or reports to customers, it's really about the thoughtful combination and interpretation of these data sets. So key opinion leader data, everyone talks about more data, and I have article data and publication data and claims data, but it's really not about the amount of data you have. It's about how you're able to synthesize the connections between KOLs.
One question I did have is, there are obviously multiple layers that you're talking about, right? Like, you not only have a single segment that these are high value HCPs, but these are high value HCPs because of X and also Y and also Z, right? Can you shed some light into your thought process around when it might be, because sometimes when you hone in too far, it limits scale so much and it kind of hits performance. But when you don't hone in enough, you may not be achieving the performance that you're looking for, or maybe the end result. How does one balance that, if you were to give any kind of thoughts or advice?
Yeah, I think it's an interesting question because it's a trade-off. If you are too hyper-targeted, you're not going to spend the dollars. You're going to have ad fatigue.
Exactly.
I think it's less about I want to serve to fewer physicians, but serving to the right physicians in the right channel with the right message. And that takes a lot. So rather than just looking at Dr. Julius's professional profile and claims, one of the things that we're focused on is, the old adage of white cloak, blue jeans. We are a consumer. We do consumer targeting, and we do this very well from a probabilistic modeling standpoint. It's not about understanding the doctor's clinical risks, but it's about understanding the doctor as a consumer, what media channels that you're focused on. For example, are you more likely to convert for CTV versus Facebook versus LinkedIn versus TikTok? And maybe there are new avenues and channels to serve media to these physicians to get them to take action. That's one way to think about engaging the physician as a person. I also think that on the claim, there's limited amount of information that happens on the claim.
Got it.
We see the longitudinal journey of a patient, sure, but consumer data, we've collected tons of information on those patients. And when you're able to, without exposing who the patient is, join de-identified claims to de-identified consumers, you open up a whole new world of insight about these patients, and you can score these HCPs based on this new in-depth knowledge of their consumers versus they were diagnosed with autism or ADHD, or they wrote a script for GLP-1, but that there's a bunch of patients who may be on a care journey. Maybe they're on a weight loss journey. Maybe they're considering bariatric surgery. It's modeled out. We don't know for sure, but that's an opportunity to engage those physicians to say, are in whatever channel, to say, are you have patients that are dealing with XYZ? Well, have you heard of this, whatever drug that you're marketing for? So
yeah.
I think that's going beyond the claim to look at the consumer panel population in aggregate. So not the risk, because risk is always something we have to be cognizant of.
Right.
We never want to risk re-identification.
Right.
So I think those are two things I think about: the physician as a consumer, And then going beyond the claim to look at the physician population, because often we need to target these physicians before their patients become a claim. And that takes an understanding of what is the pathway, what are all the things that happen before they get diagnosed.
Right.
Bariatric surgery, for example, it's a long dovetail. You're seeing that decline, but typically you see a primary care, then you get referred into a specialist, then you have to do a community you sit through some sort of intake session, and it's usually like 2 years before someone actually gets the bariatric surgery, which is why you're seeing GLP-1s explode, because it's a magic treatment that's having results. I guess that leads me to another thing is, one area I think we do really well is using the data to understand referral patterns.
Okay.
And there are oftentimes things that primary care are referring into some sort of specialist.
Right.
And that's more on the health system side, but it also relates to pharma, because what types of medications or drugs are being prescribed. So if we think about mental health, which is one of the fastest growing service lines in America, primary care is going to refer into behavioral health specialists. And you need to be able to not only have the data, but to be able to interpret what are those shared patient relationships between the entities, between the primary care organization and the standalone mental health organization, behavioral health clinics, understanding who's referring where and what. And I think we do these types of pathway analysis is what we call them.
Right.
And that the end result is not only a data and report that our agency partners use with end user clients, build credibility and trust, but it leads to the right type of HCP audience selection based on referral patterns, where there are, if you were just looking at the diagnosis or procedure codes alone,
Right.
you wouldn't really understand the context of those relationships. And if there are people who are overwhelmingly referring to one entity or writing one type of script, you might not want to waste your media dollars on them. But it's not about, again, lowering the addressable market of who we're marketing to. There are oftentimes clients will say, here's my target list.
Right.
And we organize that with our reference and affiliation data. But I've seen it many times where there are many more targets based on the sub-service line specialty, based on claims volume, based on a variety of factors, where we can enrich and augment that list beyond what our clients think their target list is.
Yep. Yeah.
That was a lot. Sorry.
No, it's okay. No, it gave me a lot to think about and a lot to chew on, because you've answered a few of my other question, which is really around, when you think about identifying what the right HCP is. But in summary, it sounds like there's a number of different paths that you can take, right? And there's the data in itself that the company is providing can allow one to really kind of determine, which path is going to probably be most viable for them, depending on what their goals and objectives are, right? Yeah. I'm going to switch gears a bit, knowing that we are partners. You are also, you're a partner with ours on our marketplace as well, which we're allowing to make available to our customers. As we start thinking about a data partner's kind of position in, obviously serving a customer from a data perspective, and then partnering with activation platforms like a Doceree, what is your POV of what makes these collaborations really successful?
Yeah, it's a great question. I think that organizations like yours, they fill a great need for our advertising partners, and marketplaces like the ones that you've launched and some of the new products you're launching. They enable democratization of the data. So it's not everyone's going to go out and spend tons of money on claims and hire data scientists to do the analyses. And I think when you look at what you offer in a marketplace, there's reciprocal value. It allows us, as we plant our flag to say Definitive has these digital capabilities. You may not have known us for these capabilities in the past. You might have known us for X, but we are good at Y. You should consider us. It gives us our ability to put our brand name out there, vis-a-vis some of the other great partners we have on the marketplace.
Right.
And then it's up to us to determine what types of segments that we are making available on the marketplace. But hopefully not only people will utilize those segments, they'll come to us and say, hey, I'm interested in what you have on there. Is there an opportunity to engage with you from customized segment that gets ultimately activated within your properties? And I think that's what it's all about, driving usage with our data set within your products and tools and offerings. And that's a win-win for us. And then ultimately leads to strengthened partnership, but also value to the end advertising partners. So that's a little bit about the marketplace. And I think I lost my train of thought on your first question.
No, I mean, you answered it really around the collaboration between our two platforms and our two companies.
Yeah. So that's on the marketplace. Sorry, I didn't mean to interrupt, but you also have this new offering, right?
Yep.
It's reminding the names of Data
IQ.
Data IQ. So I think we talked about this before, Julius, and I think that's really compelling because, again, democratizing all of the different touch points that happens from HCP, whether it's intent data, claims data, and you are essentially, this analytics platform is a brainchild for these different data points and elements. And what I'm interested in is the strength of some of my data sets, like the key opinion leader data set, as a feeder into this, right? Typically, we see medical affairs, people are doing research, understanding conferences and launches, but I think that this data set from the Monocle product that we acquired is underutilized from an activation perspective.
Yeah.
So I'm very bullish on this data connecting to Data IQ as well as KOL specific segments within the marketplace.
Yeah, we'd love to have it. Yeah, and again, like I've seen the Monocle platform and the power and kind of the deep data that you all offer within that platform, and I think it'll be hugely valuable as kind of connecting the pieces that we're looking at connecting with Data IQ, which is great. I have two more questions for you. So, as we have customers likely listening to this, and maybe even some potential clients and users of the data, if we were to think about your brand and market, what would you want them to associate your data with? Like, what would be top of mind that they could say, like, they're the right partner for that?
Yeah, I think the biggest message that I would like your clients and customers to understand is it's a new Definitive. The company is started in 2011, and we're not the same company as we were 10 years ago. We've acquired a lot of different entities and we strung them all together. And if you haven't looked at us in a while, we have new offerings, and they drive results. And so a lot of times people at these trade shows are like, oh, I know Definitive. I'm like, hey, have you met the new Definitive?
Right.
I came by acquisition. Did you know we do digital? We do probabilistic modeling. We do activation.
Right.
That's not something they typically associate with with. And so I think that's the biggest message. And I think if clients, customers are willing to take a second look, I think that they'll be pleasantly surprised by the performance uplift we're seeing in some of our audiences via HCP, was what you focus in, or even consumer targeting. So that's, again, a new foray, and we're intentional about growing this business and committed to it. So that's the biggest thing I would relate with Definitive. But of course, the strength of our reference affiliation data is the backbone. Understanding how these entities relate to each other is where it all starts. And we're still very good at that too.
Yeah. Yeah. And I hope that our relationship and our partnership will play a huge role in amplifying that message out in market to try the new Definitive, right? Like, let's not think about what you were in the past, but what you are today, right? And what you can offer, which is great. I'm going to ask this question. I've asked every data partner or like even partner podcast participant this question. So it'll be a nice single thread. It's okay. It was there, but if you can just bear with me and then you can answer it however you'd like to answer. If you could have one superpower to make HCP engagement more impactful tomorrow, what would it be and why?
So it's a great question. I think this is less about data and advertising and more about, if I had one magic wand, the thing that I'd like to see fixed, well, it's two things. One, solving clinician burnout problems. It's rife within health systems. I think you see capacity in health systems. You see this is a huge issue, and there is some tech out there trying to address this type of problem. It's hard to gain mind share and to really get HCPs to take action when they're overwhelmed and burnt out.
Right.
So I think it starts with thoughtful approaches, whether that's legislation or tools or systems and organizations to identify when clinicians are burnt out.
Yeah.
And that makes our job easier if HCPs, clinicians, physicians are not overwhelmed, then they have more time to be more thoughtful about the care that they're delivering to their patients. And then they'll be more receptive to messages. I think the second thing is you're seeing everyone talk about AI, and you're going to continue to hear that message. And I think to me, it's always about the thoughtful combination of data and the interpretation. But I would like to see real laws and legislation really be, I would like to see things change towards how AI is looked at within our industry.
Right.
I don't think it's not that there's like tons of restrictions, but I don't think that laws are being built within healthcare marketing with artificial intelligence in mind. And I think that is going to need to be addressed over time in order for us to continue to innovate with what we do in healthcare marketing.
Yeah. Fantastic answer. Well, MJ, I really appreciate the time. Thank you so much